My name is Saiken MD, and I'm a Dr. VTuber and internal medicine doctor in real life. Let's talk about brain death, not just an insult for your average League of Legends player, but an extremely nuanced diagnosis that demands time and testing to do right by both the medicine and the law. Starting with some anatomy, your brain basically has two parts, your cerebrum and your brainstem. The cortical areas of your cerebrum control your higher level functions, like your ability to think, produce speech, and recall memory, and your brainstem controls your very basic functions, like the ability to breathe or maintain a heart rate. In normal death, cardiopulmonary arrest, like from drowning or a traumatic car accident, leaves these areas without any blood flow, and then you die. However, in brain death, the cerebrum can completely lose blood flow while a part of the brainstem can continue to function. This can happen during a cardiac arrest where a person is down for X amount of time and is successfully resuscitated, but ultimately has sustained irreversible damage to the brain that is incompatible with life. This person can survive on a ventilator with machines supporting the work of these basic human functions, but ultimately it's impossible for them to recover any brain function and thus will absolutely never wake up. Thus, it is the job of the physician to declare brain death in this scenario and appropriately discontinue life support and communicate death to the family. The first step is to rule out any mimics and confirm the underlying cause of brain death. You can't pursue additional brain death testing if it's possible that the patient may be suffering from overt hypothermia, neuromuscular paralysis like in botulism, sedative intoxication, or any other reversible causes of their presentation. The next step is to exclude confounders by using a warming blanket to bring them up to normal temperature and pushing medicines to create an adequate blood pressure, correct electrolyte derangements, and reverse any sedation. Third is a dedicated neurological exam to confirm coma and a lack of pupillary, corneal, oculocephalic, oculovestibular, cough, and gag reflexes. If the above are compatible with brain death, then you proceed to the final step called the apnea test. You oxygenate and disconnect the patient from the ventilator and record an arterial blood gas from before and after 10 minutes. A blood pH of less than 7.3 and a PCO2 greater than 60 confirms the absence of a respiratory drive, and brain death can be pronounced. If any testing is inconclusive or you're unable to rule out any of the confounders, a confirmatory ancillary test like a transcranial Doppler ultrasound or cerebral scintigraphy is required to demonstrate complete lack of blood flow to the brain. In a conclusive brain death examination, this isn't required in the United States, but in countries like Brazil and India, at least one ancillary test is required no matter what. If you want to teach me something for a change, look at the law in your country and let me know in the comments. If you want to learn more, or if you're interested in pre-med or going to medical school to become a doctor, follow me on Twitch and X at SaikenMD.